Okay, so what I wanted to demonstrate here is just why any dog bite wounds need to be assessed by a vet. So this wound here, it's quite small on the surface. The dog's had a little bit of a lick at it, but the hole itself there is quite small. Then in a little while I'll show you what this looks like underneath and why we need to be checking these out and surgically exploring them just to make sure we don't run into some problems. Okay, so we've just clipped the hair away from this wound, and now what you can see is there's quite a bit of hair within the wound itself. We're starting to get some dead skin here. Now what we always get with dog bite wounds, we always get kind of some sort of mark from the other teeth. So this dog is obviously bitten like that, and we've had a canine go in here. So the reasons why we tend to find these wounds are a little bit worse than they look. One is because when the dog bites, they do tend to push hair into the wound and other bits of dirt. We also find that the tooth basically as it goes in does a bit of damage underneath, and with this biting sort of motion sometimes we find the skin can actually be pulled away from the underlying tissue. But also what happens is when the dog grabs hold, they quite often shake. Now the skin will move with the mouth as the dog shakes backwards and forwards, but underneath we quite often get a lot of muscle getting damaged. So that's why it's really important that these get checked out and treated appropriately. Without appropriate treatment, what we can quite often get is a large amount of skin death, and that makes a very difficult thing for us to treat.
Yep.
Okay. So this is what it looks like inside. So you can see, even though it looked like quite a small hole on the outside, it's actually gone in not far off a finger's length into the neck. So what we've done is we've cleaned up all this dead tissue, and that's going to speed up the healing process by about a week. It's allowed us to clean this up, which is going to reduce the risk of infection. So what we're going to do now is close this so that it's going to heal up nice and quickly, and we should find that 10 to 14 days we can take the stitches out and this dog will be all healed up. But yeah, like I say, it looked like quite a small wound on the outside, but you can see quite extensive inside. So this is what the wound looks like after we've finished closing it. So we've got the little drain here just to drain out any infected fluid over the next few days, because anytime we get that much trauma we're going to get a collection of fluid. The rest of the wound's stitched up quite nicely, so we'll pull out this drain in 3 days time, the rest of the stitches in around 10 to 14 days, and that should heal up without any problems.